called America's Hidden Healthcare Crisis, a conversation inspired by PBS and WETA's Caregiving documentary. I want to welcome those of you who've joined us in the room. Thank you, thank you. I know we're competing with a lot today. I know we're at the end of the semester, there's world events, and it's the middle of the day. I want to thank those of you who joined us on the webinar as well. Also, thank you to our panelists, to the Public Health Student Association for putting this on as part of National Public Health Week, as well as WETA and PBS for allowing us to use the clips of their upcoming documentary, Caregiving. So I do want to tease a little bit. We will be partnering with WETA and PBS to have a screening of this documentary on June 3rd here on the GW campus. And if you are interested in receiving an invitation to this free event, there will be a QR code where you can provide your information at the end of this session, both if you are joining us via webinar or if you are joining us in person. So I'm going to start by introducing myself and our three panelists today. So I'm Dr. Melinda Power. I'm an associate professor here in the School of Public Health. I'm in the Department of Epidemiology. I'm also the director of the Institute of Brain Health and Dementia here at GW. And for those of you who are unfamiliar with our institute, our goal here is to promote high-impact multidisciplinary research, educate the next generation of clinicians and researchers, and support awareness and positive change in the community around brain health and dementia. To my right, this is Dr. Christina Prather. She is a geriatric and palliative medicine physician. She's also an associate professor at the George Washington University School of Medicine and Health Sciences, as well as the clinical director of the Institute for Brain Health and Dementia. Dr. Prather works with individuals and families living with cognitive impairment and dementia, aging, complex health conditions, and serious illness. So really everybody. And she partners with patients and families from diagnosis to the end of life. To my left here is Dean Brenner. Dean is the chairman of the DC Brain Health Coalition and the local Alzheimer's Association chapter board. He is also a caregiver for his late mother, and Dean has been a longtime advocate at the federal and local level for people living with Alzheimer's and their families. And finally, to my right on the end is Alison Barkoff. Alison recently joined the GW faculty as the Hirsch Health Law and Policy Associate Professor at the George Washington University Milken Institute School of Public Health. She is also a nationally recognized disability and aging expert and advocate, and you've probably seen her on the news if you've been paying attention. Prior to joining GW, she led the Health and Human Services Administration for Community Living, or ACL. And relevant to today's discussion, she led the development of the first ever national strategy to support family caregivers in that role. So a little bit of an orientation to what we're going to do today. We're going to start our discussion and engage our panelists by viewing clips from the documentary Caregiving. And as we look at these clips, I encourage you to think about your own journeys, your own families, and then we're going to use them to prompt discussion from our panelists. We're going to hold Q&A until the end, and we'll be taking questions both from the audience in the room and from the audience online. And we hope to have some time to engage with you in that forum. Christina, I want to open the conversation talking to you. Wear many hats in your clinical work as well as your advocacy. And you see caregivers in the hospital, in clinic, and in hospice. You see caregivers out in the community, the activities you engage in there. And you talk about caregiving and its impact and importance to the students that you educate here at GW. We titled this panel Americans' Hidden Healthcare Crisis because despite being everywhere, in some ways it's still hidden. What do you see that you wish everyone else would notice?
Thanks, Melinda. And I appreciate the opportunity to be here today and have this conversation with those of us who are in the room and those of you who are online. When I see caregivers in the role of a clinician, I see every single day that caregivers are such an essential part of the lives of the patients I'm caring for, right? I see it as a geriatrician. I see it as a palliative physician. I see it when I'm working in the hospital, when I'm working in the clinic, when I'm working in hospice. And one of the things I'd really like you all to take away today is that caregiving is happening everywhere. So some of you in the room might have been caregivers. Some of you online may have been caregivers. If you aren't a caregiver now, you likely will be. Yes? Excellent. Okay. And most of the caregiving that's happening is happening outside of the healthcare environment, right? It's happening at home, in the community, in apartments, in condos, in assisted livings, in nursing homes. And the people who are providing that caregiving don't have formal training. And so we're asking people to navigate this challenging and disorganized healthcare system, fight for services and insurance coverage, juggle caregiving while working or taking unpaid time off, right? And sometimes even needing to leave the workforce. And those consequences themselves, right? We like try to get a grasp of the economic and personal cost of that, but it's huge. And then on top of that, we ask people to provide all this medical care. So I have 4 years of medical school, 3 years of residency, a year of fellowship training in geriatrics, a year of training in palliative medicine. And yet we ask people to go out and do wound care, manage complex medications, dressing changes, navigate all these clinician appointments, and know what to ask and how to take care of their loved ones. And so for a lot of our caregivers, things start small, like one little role, and then it builds up over time. Maybe you start by just taking your mom to a doctor. And then you start by helping her with her medications. And then the next thing you know, you're a full-time caregiver and juggling your work, your own family or not. And it becomes all consuming. And so that's what I really want people to take away with, right? We all fill this role at some times in our lives, and we're asking people to do it and figure it all out on their own.
So, Christina, this is an incredibly important role that so many people take on. And I know that so many people, if you talk about caregiving being a burden, they would say, no, this is something I want to do. This is something I need to do for my loved ones. And they get so much out of it. But we also know that there's some real costs associated with being a caregiver. Can you talk a little bit about that?
And so second thing I want you guys to take away, one, everyone's going to be a caregiver and you're not going to be trained how to do it. Second thing we're going to have you take away is that caregiving has a health impact, even for people who love being a caregiver, because there are people who love the role of caregiving and it can deepen incredible relationships and brew exceptional joy. Think about the mother and daughter in the middle frame of that teaser where she was holding the video with her mom. She looked so in love with that relationship with her mom in that moment, right? But even when you love doing something, you can burn out. Even when you love doing something, it can take a toll. And then on the flip side, there are people who never wanted to be caregivers who have to be caregivers. And that is really tough too. So I'm going to tell you a story because I want you to just have a person in mind as we think about caregiving. I'm going to tell you the story of a daughter, I'll name her Mary Celis. And she's a caregiver for both of her parents, and it's really stressful. And I took care of both of her parents who were living with dementia. And they're kind of a hoot. They're like the most amazing people. They told the best stories. Her father spoke like 5 languages. I never really knew which language I was going to get on any given day. He was a ship captain, and he would like regale me with these tales. But the impact of taking care of her 2 parents, she developed high blood pressure, her diabetes got worse, she was fatigued, she was depressed. And in our visits, I would say to her, I'm worried about you. I'm worried that if you don't take care of you, there's not going to be anyone to take care of mom and dad. And she'd be, yeah, I'm fine, I've got it, it's fine, I'm doing it, no big deal, until her own health crisis, right? Fast forward several years, we've addressed her medical concerns. I'm not her doctor, but we've gotten her to a doctor. We've got her parents, her mother's deceased now, her father engaged in community resources. Her husband is now the paid caregiver for her dad. We're caregiving as a unit. And it's taken years to set that up with huge impacts on her own health, right? And so this is just one story. One of the things I love about this video is that it tells so many stories. And what I'm really hoping is that as people see the video, they recognize something in it that resonates with them and they can feel that they're not alone and feel empowered to ask for help. And so I will just close that there.
So before we let you go, Christina, and move on to our next clip, I really want to thank you for sharing that story from your own practice. And I want to know if there's any closing words for, any aspiring clinicians or aspiring advocates in the room. What do you think that, if there's one thing you want them to take away today, what would that be?
I'm going to ask people in the room to close your eyes. Raise your hand if you've been a caregiver. Okay, put your hands down. Open your eyes. Sorry, I didn't want anyone to have to call out publicly whether or not they'd been one, but it gives us an idea of how many people in the room, even this room, for those of you online can't see, is full of students, young people, right? And even the young people in the room, half of them have raised their hands indicating that they've been in this role. And so that's the take home. Everyone is going to, in some point, have a role in caregiving. Sometimes it's from a disease, cancer, diabetes, dementia, Parkinson's, but sometimes it's just from aging. We're not intended to age alone. We're intended to live in community and to share the joys and the work of all of life's stages. And so I know many of the other panelists are going to talk about this, but we have to get caregiving out in public. So caregivers are not cut off from friends and family. And as healthcare providers, and those of you working in the healthcare space, we really have two important roles. And the first is to own the caregiver as part of the patient's team. Stop pretending like they're not part of the conversation. We have to bring people actively into the care plan for our patients and recognize the critical, pivotal role that they play. And then the second thing we need to do is to not be silent. We need to use our voice to elevate the experience of our patients and what our caregivers need. And so that's my call to action for people in the health sphere. This is our lane because health is our lane and the health of our caregivers matters as part of the care of our patients.
So that's a great transition to our next clip where we're going to really meet a pair, a caregiver and someone who's receiving care in our second clip. So I think it's really important that we keep stories at the center of this conversation, and that's what's so powerful about this documentary. And so I want to turn the conversation to you, Dean. I know that you have done a lot of advocacy work, but you've also been a caregiver. You were a caregiver to your late mother. And you were a caregiver for a neurologic condition, just like the caregiver in this video. The condition was dementia. And dementia is a condition where caregivers are so incredibly important, right? They're so incredibly necessary. And so I'd love to hear a little bit about your experience and as well as, both as a caregiver yourself and as a longtime dementia advocate about the role of caregivers and how we've made progress in really thinking about the caregiver as part of healthcare and healthcare treatment for this disease. Because I think in dementia, we have started to make progress about thinking about the caregiver as part of this process. And then also what else we need to do. So I'll turn it over to you.
Thanks so much. And thanks so much for having me here today. I have to say, one of my main thoughts today is how unlikely it is that I would even be here. I was a lawyer at a big company. I worked 29 hours a day. I focused on Duke basketball and politics, and I couldn't spell Alzheimer's. And why would I have to spell Alzheimer's? What the heck is Alzheimer's? And my mom was the first woman in the history of our small town to be elected to our town's council, a giant personality. She had been elected to our town school board 7 times over 21 years, knew everyone in the whole town. And then this nuclear bomb called Alzheimer's reared its head. And the question, so there's no course at GW or at Duke or at Georgetown Law School in caregiving, right? So, and I have 2 brothers. I'm the middle child, okay? Another unlikely deal here. And so the question was just like, what kind of person do you want to be? Do you want to hide under the table? Do you want to just pretend that everything's fine, that this is just normal aging? Or do you now have in addition to telecommunications law and Duke basketball, now you have actually something that makes those 2 things pale in importance, and you got to learn. And what the heck are you going to do? And I have a family, a wife who's a disability advocate, and I have 2 great sons, and they're looking at me. And they're saying, what are you going to do? Like, what are you going to do? And so that's the deal here. And, in the history of the world, no one volunteered and said, I want to be an Alzheimer's caregiver. This thing just gets dumped in your lap. And then the question is, everything has changed. So, the hierarchy is my mom is in charge of her 3 sons, this big, strong, independent person. And that hierarchy is now totally called into question, and you can't just overthrow that hierarchy. And she's scared to death, cannot tell me what support she needs, and is also scared to death. And this feeds into Alison's lifelong work of keeping people in their house. And my mom is living in the house that she'd lived in since 1963, and she's not going anywhere, and she doesn't need any help, and she can't tell me what help she needs, and we're drowning in the Atlantic Ocean. That's how this whole thing is. So fast forward, because I had a secret arrangement for 2 years with her housekeeper, who would email me and text me and call me, and who I paid a weekly wage to. This is not just friendship. That was the arrangement for 2 years, and then it got much worse. And so then the arrangement was that I paid for a live-in aid with my mom, and I was there all the time. And yeah, that's how I answered the closed book test of what to do. But speaking up within a family where other people in the family are saying, like, you're making way too much of this. This is just normal. Finding a doctor who isn't going to just blow you off, as Christina was saying, we were chatting beforehand, until 2013, even the pre-Alzheimer's stage wasn't even recognized as an ailment. So, finding a doctor, and then in my case, the doctor really was of no help whatsoever. And then finding out what kind of supports the person needs and putting them in place. And I had it very easy, my mom I was able to keep my mom in her house, and I think that's what most people want. That's why we have an agency called the Administration for Community Living. And so that has really driven me, that, and the feeling of being alone, which Christina also referred to. I didn't need like global help. Like, I'm not trying to solve, a global crisis. I'm not trying to solve a national crisis. I'm not trying to solve a problem in the state of New Jersey. I got one teeny tiny but gigantic micro problem in the town with 17,000 people, and I need help like right there. And I think that's the way most caregivers feel.
Thank you so much for sharing that. In your work as an advocate, I think we've made some great strides in trying to incorporate caregiving as part of the disease management process, at the policy level and then also at the clinical management level. Can you talk a little bit about the scope of the problem and then also the progress that we've made?
Yeah, thanks so much. And we've made a lot of progress because of people like you, Dr. Power, people like you, Dr. Prather, and Allison. And so the way I look at it, so I didn't make a slide, and this is shows you what a low-tech person I am, but I have a little Venn diagram. And I don't know if you can even see it, but it's got 3 circles: prevalence, progress, and public policy. So prevalence, you saw the statistic that went by in the video, 53 million people that are caregivers. Alzheimer's, there are about 7 million people who have Alzheimer's. There are about another 7 million who have kind of the pre-Alzheimer's stage and other forms of dementia. So if there are 14 million people who have it, there are at least 14 million, maybe more, caregivers. So it's everywhere, right? It's being a caregiver is everywhere. And we have made progress, hard-fought progress. So one thing that we've made progress on is there's a program that we lobbied for, we, the Alzheimer's Association, lobbied for, called GUIDE, which is a new way to deal with dementia care, which includes not just the person living with dementia, but providing supports for the caregiver, providing navigation. So I went to the hospital with my mom in the last 18 months of her life 6 times. It's very common for someone with dementia at the same hospital in Red Bank, New Jersey. It's a fine hospital, and every time I was just starting from scratch. And there were multiple doctors, and as Christina referred to, in the healthcare system, each doctor often is an island and running back and forth. And, I don't know anything, I knew how to file pleadings at the Federal Communications Commission. I didn't know anything about this. So we have a federal program in place. It's a test. Hopefully the test will go well. And even for institutions that aren't in the test, it's the first federal recognition that support for caregivers is part of this problem. We also have programs at HHS like the Healthy Brain Initiative and a law called BOLD, the Building Our Public Infrastructure for Alzheimer's Act, which is basically treating Alzheimer's as a public health issue. That when I was going through it with my mom, I kept Googling the county health agency and county aging agency, and they had nothing whatsoever. It was like they had nothing. I just didn't understand it. So we have made progress. And then, we have this 18 alarm fire raging called public policy right now. Cuts to Medicaid will decimate caregivers. And we're cutting NIH grants for Alzheimer's research. Nobody voted for that. Why are we doing that? And I can, send stuff out. I put stuff on LinkedIn every single day that, either in the name of DEI or whatever, we're cutting back on these programs, and it's alarming.
Yeah, so I think it's a great example of how through advocacy and through research, we've been able to kind of start thinking about the caregiver as part of the disease management process and get some services and policies in place to really do that. So before we turn it over to taking even a broader macro perspective, we're going to watch our last clip, and then we'll turn it over to Allison for our final panelist discussion. So Allison, as this clip notes, caregiving has really entered the national conversation, and no more so than while you were at the helm of HHS's ACL. And while you were there, you developed the first ever national strategy to support family caregivers. I'd like to start the conversation there. Can you tell us a little bit about that and what that looked like?
Sure. I am really excited to be here and take what is most important, which is people's real experiences, the experience of caregivers. And I don't want to be lost in here. We are also talking about the experience of people receiving care. And how do we take that and go from, like Dean was saying, one person feeling alone to literally building a caregiving system? And that's what some of the work of the Administration for Community Living, which in its mission is about supporting older adults, people with disabilities, and caregivers to be able to live in their own communities and get the support that they need. caregiving is so universal, yet there is a lot of diversity in caregivers. And some of that really was the bottom line in what the National Caregiver Strategy was about. We're focusing a lot here on maybe someone like Dean, an adult child taking care of an aging parent. But there are spouses taking care of each other. There are people like me who are a sibling of someone with a disability and taking care of someone with lifelong disabilities. Parents taking care of children. And we've seen, as you mentioned, children taking care of siblings and parents. And we had an incredible opportunity to take the visibility that happened during the COVID pandemic. It had been so invisible, yet people saw, you would open up the paper literally every day and see people losing services and families stepping in because we do not have a system. It is actually an incredibly bipartisan issue. Just before the election, there was a poll, and 80% of both Democrats and Republicans want more investment in caregiving. And the work of the Administration for Community Living to create this national strategy, the first ever national strategy, not just in the US, but actually around the world. Canada just put one out in the last few weeks based on ours. I presented at the United Nations on this. Countries around the world are looking at us. And what this was about was literally looking at those commonalities and what needs to be done to build that system. So the first thing is just some cross-cutting principles. As we've heard from an individual basis, it is really making sure that everything we do around caregiving and in the medical system is both person-centered and family-centered, making sure families are part of that care team. For too long, people are just expected to do this work, yet they're not part of the conversation about how to do it. Secondly, there's so much diversity in caregivers' experience, particularly when we look at underserved communities. And we have got to make sure that people who face additional barriers because of language access, because of income, because of being LGBTQ, et cetera, have the support that they need, and we are being intentional there. And then that we are thinking about this big care ecosystem. We heard in Dean's experience, it wasn't just Dean providing care, it was also this combination of paid care and family caregivers. And how do we make sure they work together? This strategy recognized we all have a role to play here. 15 agencies were part of developing this strategy along with the council, reflecting the diversity of caregivers, and 350 commitments, not we might do's, but we will do's, came out of this from federal agencies. And we held people accountable. We did a report to Congress 2 years later, and literally every single one of those had either been completed or started. Guide was one of them, putting in new billing codes in Medicare to be able to pay for training of family caregivers. The first regulations for family caregiver support programs in the Older Americans Act, expanding the Veterans Affairs caregiving programs. And we were very clear, the federal government alone cannot solve this problem. So there were recommendations to Congress, recommendations to state and local government, to businesses, to philanthropy, to advocacy organizations. And we have seen this strategy really not only in the work of the federal government, but 72% of states recently reported they relied on this in advancing caregiver policies. Coalitions of people, and Ai-jen was one of the speakers here who has really brought together aging and disability and caregivers and the direct care workers to work together. $100 million from philanthropy around caregiving initiatives just in the last 2 years. And we're starting to see more and more from businesses around family-friendly caregiver policies. If we cannot have a good paid leave policy in this country, then we are going to need businesses to start stepping in a lot of ways.
That sounds absolutely incredible. Can you talk a little bit more about the continued progress that you're seeing, and what are the next steps that you'd like to see us take?
So I'm going to talk about progress and risks. And if anyone is interested in this, I recently, for Health Affairs Forefront, they really wanted someone to talk about the political landscape at the beginning of the administration. So I think we both have some opportunities, but as Dean referenced, we are facing some of the most dire risks to the progress that we have to date. So the opportunity is the fact that this is bipartisan and that the visibility has never been higher. We had an executive order from President Biden on care, a whole event at the White House in the Rose Garden. That created this level of visibility that truly had never, ever existed before. We had both presidential candidates, including President Trump, talking about caregiving proposals. We have bipartisan legislation that's been even reintroduced in this Congress where there has not been much bipartisanship, like the caregiver tax credit. We've seen states hugely interested in this. There are several learning collaboratives that have been funded, and there are so many states that keep trying to get in and really wanting to make progress at the state level. And we don't just have people like Bradley Cooper. We have Seth Rogen, who has a caregiving organization, Colin Farrell, who just launched one. So the visibility and the bipartisanship is our opportunity. But we are facing some incredibly unprecedented risks. The number one funder of in-home supports and also nursing home supports and supports for family caregivers is Medicaid. And literally 2 hours ago, the House just passed the budget reconciliation instructions that had been passed by the Senate. And that means we are now moving very, very quickly towards a potential $880 billion cut, to the only place that provides supports to older adults, people with disabilities, and family caregivers. It would be devastating. Just last week, HHS announced a reorganization. We're all talking about the Administration for Community Living. And a week and a half ago, they announced we're dismantling the Administration for Community Living. We're spreading some of its programs across the department. Half of the staff were fired. And so we are going to have to work really hard to make sure that these programs continue. But I want to just make sure to leave people with a little bit of hope, because it is the stories that you are hearing up here that makes the difference. That is the advocacy. Just yesterday, and I know Dean's wife was there with literally thousands of advocates on the Hill talking about why Medicaid is important. And it's not that they came in with the data, it's that they came in with their stories. And it's causing a lot of heartburn for anyone who was watching the last 48 hours. It's those stories that are causing a lot of heartburn. So you all can make a difference. You don't have to be a policy wonk. You have to just be in a place to talk about why these programs are important and to help advocate against further cuts, to make sure that Congress understands what is at stake here, and for us to keep lifting up the momentum. You all are so well positioned to do that, and it is a more critical time than ever for advocacy.
Thank you so much, and I appreciate the message of hope. So this is the part where we turn it over to our audience for Q&A, both here online, both online as well as in the room. So if you have a question in the room, I encourage you to come up towards the front. I promise I won't make you come on camera, but it would help us since we are down to one microphone if you could come up front. And I will also look at the Q&A real quick and see if there's things there that we want to address.
How about the room? Y'all are not shy. What do you got? Yeah, I can repeat the question if you don't want to come down.
Well, I currently do research with a professor in organizational sciences here at GW on informal caregivers. So, those who are not paid can be family, friends, anyone of elderly specifically. And one of the things I'm trying to look into is how to boost training programs, specifically on medical care for these informal caregivers. My mom is still an informal caregiver to my grandfather, to my grandmother. So just trying to look at that, because when I'm reading online, like there's many different articles, and then I'm also doing kind of country comparisons, but I don't really know how helpful that is, because, you know, how can we implement something that may not potentially be implementable here? So
So I'm going to repeat the question and then I'm going to pass it to my very eager panelist over here who's reaching for the microphone. So for our audience online, the question is about how can we create the informal caregiving education that becomes then formal for informal caregivers to support them in a marketplace where when you're looking, there's just like a lot and nothing online at the absolute same time. And a specific example was given around an adult who's caring then for an adult aging parent.
Hey, thanks so much for that question. So here in the District of Columbia, I live in DC itself. So I've done years of lobbying, of advocacy with the local DC government and with DC Health, with the DC Health Department. And in the beginning of that advocacy, I found out that there wasn't a single person in the DC government who had anything to do with Alzheimer's. So the health department thought it was an aging problem, the aging department thought it was a health problem, and we were just in this gap. Since then, fast forward, that was about 7 years ago, the DC government has really responded, and it's really what Alison is talking about. You know, when we go in to do quote unquote lobbying, we tell our story to an aide, to a city council member, and that aide has his own or her own caregiving story. It's very rare that the aide says, oh, like Alzheimer's, I don't know anything about that. No, it's usually my grandfather, my grandmother. So fast forward, we have the first law in the entire country that in DC, that requires that all direct care workers get training in how to deal with people with dementia. 8 hours of training initially, and then on an ongoing basis, a refresher course. And as part of that, we were able to get a grant for DC Health. And right now, if you go on brainhealth.dc.gov, there are online training videos. But the interesting part is that there's a whole section of the videos for caregivers. How to be a caregiver, how to deal with medications, what to say at the doctor, all that stuff. And we're hoping that it becomes a national model, but the DC government, DC Health has really responded. And of course, it's all tied together in part. Some of that is because there is federal funding through HHS, as Alison said, through a law that was passed unanimously on a voice vote.
And if I could just add, and I'm happy to connect with you afterwards, I would really encourage, if you have not read the national strategy itself and the follow-up report, there is a lot of information in there. And in fact, you know, success begets success. We put this report out, and actually Congress increased the funding to the Family Caregiver Support Program, which in many places they do use to provide training to people. And we got some additional funding. They now, ACL, got some initial funding to launch some projects of national significance related to caregiving. And again, you know, big question mark with the ongoing funding, but one of those 5 projects that was launched was specifically focused on identifying evidence-based practices for training of unpaid caregivers. And so there is a lot of momentum there. I think we will see it, like Dean said, at the state and local levels. But very happy to connect with you, and thank you for that research. It's really important.
I just want to pivot on how hard it is to find those programs online, which I think is getting at the crux of your question. When I sit with patients and family members, I have like all of these phrases that I keep on documents. I can copy and paste and put into caregiver patient information at the end of my clinic visits, because it's like this random collection of YouTube videos, and UCSF has a site, and this DC Brain Health has a site. By the way, that's a result of a partnership of the School of Public Health with DC Health that our institute was a part of. That 8-hour caregiver training, that's something that we help develop as advisors, as leaders, clinician, and public health members in our community, right? And so we are always trying to get out of our walls. But to this point of like, where do you find this content? speak to, it is so hard. And the best place to get that information is from people who have found it themselves, which is caregivers, right? Is going to the source and saying, what have you found? How did you find it? And running that down.
Great.
Kind of leading from that, I kind of have two questions. One is like, how do you motivate existing caregivers to seek further training like that? Like when they're already comfortable in their routine? My experience has been with an autistic sibling, so more like lifelong caregiving. And I know that my mom has, she's also a caregiver. She's experienced like burnout over periods of her life, most recently with like my sister's dental care. And I found this accessible toothbrush, and that's been really great. But it's like, how do you, she's been caring for her for 30 years. So it's like, how do you motivate them to seek like that 8-hour training after years and years of caregiving? And then a second question is, do you ever see different benefits when you're in conservatorships, relationship with your patient and the caregiver, or like from the federal government or Medicaid? Pass on a second.
Yes, but I'm going to repeat the questions for those online first. So the first is, how do you motivate caregivers to engage with available trainings, especially those who have been caregivers for a long time, who may not be motivated to seek it out on their own? And second, the question is, are there benefits, or how does the relationship change when you have conservatorship in the mix? And I'm going to hand it over to Christina to begin.
So I teach my medical students to ask one question, which is, how long can you leave your loved one alone? If they look at you like you're crazy, that's good. That's good. But sometimes people look at you and are like, 15 minutes. And it tells me in one question how intimately engaged they are in caring day to day, right? So just one takeaway. Then to the question of how do you engage, right? Because not everyone is in that tight of a caregiving dyad. I ask, is there anything that if we could make just one thing smoother, just one thing? I know that you are doing great. I see how much you love and are engaged as a care partner. But is there just one place in your day where if we can make things a little easier, it will go a long way? Sometimes it's, for me, it's someone says like, oh my gosh, if we could just this medication regimen, if like 3 times a day, I'm like, cool, that doesn't need to be at night. That can be in the morning. That's a twice a day. I'll order a once a day long acting, like bloop, once a day meds. Instead of 15 pills, here's 7, right? But I had to ask that question to get that. Favorite story, because we're living in stories. I had a care partner once say to me, it was a spouse of her husband with Alzheimer's, I just want to have my cup of coffee in the morning before I have to be on. And I looked at her and was like, girl, I hear you, right? I hear you. And my question was, what makes more sense? Putting a Keurig in your room or letting him start his day with the television? Neither might be the right answer for you, but let's brainstorm because we can fix that, right? And so you fix one you tweak, it's not a fix, you adjust one thing, and suddenly it's like, oh, maybe I can breathe. Maybe the tightness in this rope that I'm living where I can't even turn and see anything else in my life has like a smidge of slack. And people can be reminded that there's something else there that they can go for.
And I'm happy to touch on a little bit your question about conservatorship and guardianship. In the 2-second version of that, I mean, what I would say is, I think it's really important to think about the person, and particularly in the disability world, for people with early dementia, there are a lot of different options. Guardianship and conservatorship is very far on one end. It literally means it takes away all rights of that person. Literally, it takes away their personhood to make virtually any decision. But there are lots of ways that people can have legal rights to help either support the person, like supported decision making, something that I know DC has, where you can have a right to kind of help the person make decisions. There are lots of legal tools like a healthcare proxy, where you can have the person still has rights to make decisions on their own, but the person also can get access and be in the conversation, help make decisions, have access to records. We need to start, and some of what we are trying to do when we are talking about the family caregiver being part of the doctor-patient relationship, if expectations are being put on them, does not require that someone be under guardianship. Of course, the person receiving care has to consent and agree, but I think there's so much information out there. And in many cases, people think it's either the person by themselves or all the way on this end, guardianship and conservatorship. And there's so many options in the middle. And the other thing I'll just say to you about your personal circumstance as a fellow sibling, like I never used the word caregiver in my head until I started doing this work. And so much of what the national strategy was about is people don't think, they're like, I'm a daughter, I'm a sister, I'm a spouse. Of course I do that. But maybe some of your role as you get older, as your brother gets older, as you have aging parents, is to think about your role as a caregiver and how to support the life your sibling wants to lead, but also taking some caregiving responsibilities from your mother, even if you are in a different place. So it was something we tried to lift up in the strategy for some people who maybe do not think of themselves with that word. It's important, and it's the first step to accessing those supports.
We have time for one more question. We're going to go to the back in the room here.
So much to everyone for sharing your thoughts today. So I'm a medical student, and I've also had the opportunity to conduct research and speak to unpaid caregivers to children with rare diseases, ranging all the way to older adults with dementia. Also have a lot of personal experiences of my own. So it was great reflection, and something I've been thinking a lot about is like the caregiving triad. So not only is it the caregiver, the care recipient, but also a provider or like professional in the medical and public health sciences. So I'm curious to know more about if there are specific ways that, at least in my case, physicians could be more mindful or trained to support caregivers. What's the role? What's the boundary? I'm just curious to hear your thoughts on that.
So the question for those on the webinar is, how can we better train or support or give guidance to the clinician or other provider who is interfacing with the caregiver and care recipient?
That's what you wish your
Yeah.
doctor had done.
Yeah, so this is something that I think about a lot too. And one of the reasons I think about it is that the most common thing that people tell me, one of the most common when I say that I'm involved with the Alzheimer's Association, is often they'll say, what's that? And I'll describe the Alzheimer's Association, a 24/7 helpline, social workers, all kinds of supports. And they'll say, oh, if I had only known about it. So like one of my serious pet peeves is I wish that, when I went with my mom to her doctor's appointments, and I was in a huge amount of trouble for going, by the way, I wish the doctor had said, hey, by the way, look at alz.org. There's this group, the Alzheimer's Association, and they're in New Jersey, Dean, and you could call someone there. Here's their phone number. So at the Alzheimer's Association, we're really focused on trying to improve the experience for people when you get a diagnosis. Because right now, the way I found out about my mom's diagnosis was by cross-examining her. She kind of let it slip. She had gotten a diagnosis. And then when I went with her to her doctor, he basically just said, oh, you're such a good son for coming to the appointment. Okay, I didn't need chocolates and flowers. I needed to know how to help her. So I wish that there was a tighter relationship between primary care doctors and the Alzheimer's Association or other supports at the time of the diagnosis.
Right. I want to speak to that from a clinician perspective as well. And so when we come back to the crisis of healthcare in this country, one of the things that I'll hold up as the center of it is primary care. And I will not say I'm a primary care clinician because that is way too hard of a job for anyone to take credit for who hasn't done it. I think it's the hardest job in healthcare. We can do an entire session on how the medical enterprise undermines really thoughtful young students who want to go into that field and converts them to wanting to go into something else that's way sexier. But that's not this talk. But that is the first failure, is robbing intelligence and dedication and passion from primary care. Number two, we straddle this hard line on patient privacy. So autonomy, privacy, huge. Needing to get collateral information from people who are losing in the stage of dementia, like cognition, or the visit I had with my son's pediatrician on Monday through telehealth because he couldn't be in the room for us to have the conversation that needed to be had. And so we have to learn how to dabble in that space that respects the individual receiving care's privacy, but also as clinicians getting the information we need to make informed decisions and develop a care plan. And that is actually a very hard line to straddle. It is very difficult, and we don't really teach people well enough how to do that. And the last piece I'll say is that we don't train clinicians necessarily, physicians, I'll say physicians and advanced practice providers, to really own that the world outside of the office is part of your care paradigm. And so that is shifting, that is changing, especially here at GW because of our public health imperative and our community connections. But we know, and this was a really big topic just a few years ago, that physicians were being told to stay in their lane in some major academic centers. And so we are in an emerging place where we have to decide how much are we responsible for as a clinician at the end of the day. If you don't have a social worker to refer to, you do have to have information to share with your patients and families, and we can't write that off. And so I invite that if people really want to work around the health crisis and caregiving. So often it's our primary care clinicians at the heart of it who are having to straddle gray zones, tough decisions, not enough time, and the lack of the care team to really help them do it.
So we are unfortunately at time. So I'm going to go ahead and close, but I'm sure that the speakers would be happy to entertain any remaining questions afterwards for those of you who are here in the room. I want to give a great thank you to those of you who have joined us today and for your insightful questions. I also want to thank our panelists, as well as the Public Health Student Association, Milk Institute School of Public Health, PBS, WETA, and for everyone who worked hard to put together the Caregiving documentary that we were able to use as our inspiration for this panel today. A couple of reminders. We are going to be showing a screening on June 3rd that we hope you will all be here to join us. There will be a QR code that will be on the screen behind us momentarily that you can put in your contact information to receive an invitation. That is true regardless of whether you're here in person or on the web. The documentary will premiere on PBS on June 24th and will be available for streaming via the PBS app on May 27th. There is also a series of short films available on wellbeing.org. That is wellbeing.org. I think there's 18 of them. So if you enjoyed what you saw today, you can get more content right now. We are also, Christina and I are representatives of the Institute for Brain Health and Dementia. If you are going to be continuing at GW into the next academic year, we'd love to stay in touch and invite you to our events moving forward. This same QR code that will get you an invitation to the Lisner event for the Caregiving documentary will also put you on our list to get more information about those events moving forward. So I want to thank you for your kind attention and for being here today. And I really hope that the rest of your week is wonderful and that the weather improves so we can all enjoy the beautiful flowers outside because it is cold, man. So thank you all for coming.
And there we go.